Hello, everyone. My name is Stephen Murray, and I'm the host of The Gift of Giving, and I thank you for joining us today. For those who are tuning in for the first time, this program focuses on the foundations and nonprofits based here in the state of Nevada who are making our world a better and brighter place. Today's guest, I'm very, very pleased to welcome our friends in Northern Nevada in Reno. My guest is Amy Thompson. She's the Surviving Programs Manager representing Nevada Cancer Coalition. Welcome to the program, Amy.
Thank you for having me.
Oh, it's a pleasure, and thanks for taking time out of your schedule to join us. I think Nevada Cancer Coalition seems to be something of a unique organization. I haven't seen much in the way of comparable operations anywhere else in the United States. Would you like to give us a brief overview of what the program does?
Sure, I can do that. So Nevada Cancer Coalition is a statewide coalition, and it was started back in 2002. It was called the Nevada Cancer Council at that time. And it really started because the CDC provides funding to states to work on a 5-year cancer control plan. So that's kind of standard across the board. And that's a lot of the time how and why coalitions are formed. And that is how we became Nevada Cancer Coalition for that reason. And so as a coalition, we thrive on the ability to network and collaborate with like-minded individuals. So our goal overall, which I know is a bit lofty, but we really want to work as a state to reduce the burden of cancer in Nevada. And we do that through statewide collaboration, through empowering people with information and connections, and helping advocate for equitable access for all. And we do that not alone, but of course, our key phrase that we like to use is the power of coalitioning. So it is that networking and again, bringing together like-minded folks because, that's the way anything great gets accomplished. So we work with people across the state as well as with national partners, trying to develop and implement programs really from prevention to early detection and survivorship. And we also work kind of more on our local level with providing outreach at events and encouraging access to cancer prevention, early detection through screening, and of course, connection to survivorship resources for people too.
Wow. Well, I have to tell you, Amy, in visiting your website, it is so comprehensive. There's so much information out there. You're to be commended on whoever's worked on that and put all that information out there, because it just doesn't benefit Nevadans. There's information out there, some of your videos and your workshops and things of that nature, some of your programs, they could benefit anybody in the United States or indeed throughout the world. So it's what you're accomplishing out there is amazing, and you're all to be commended for what you're doing.
Thank you. Again, a team effort. We have a lot of really great creative folks working on all that stuff.
Yes, well, you certainly need it. And I don't think any one of the viewing audience, I don't think there's any one of us that haven't been affected in cancer either, by cancer, either personally or know friends or family or loved ones. We all know somebody that is either passed from cancer or who is living with cancer. So the education you're putting out there is great. And yes, I did see a quote from your web, and it says, we envision healthy communities across Nevada with equitable access to quality cancer care and support for every human being. That's a big goal, and we need your help to accomplish it. That's a very, very lofty goal, Amy, and an admirable one. So how far along the way do you think we are to accomplishing that? Are we getting it better and better, or are fewer and fewer people getting diagnosed with cancer in any shape or form, or are we discovering new forms of cancer every time we turn around?
Yeah, there's a lot of parts to that. So it takes a village and there's a lot of pieces to this. So I think, with advances in technology, ways people can get screened, there's so many different parts of that. So people are living longer, which is a great thing, but that also means that there are challenges that survivors face when they are living long term from the side effects from their treatment. So there's needs in that area to be addressing their quality of life as well. And then on the other end of the spectrum, there's a lot of things that we can all be doing to help reduce our risk for cancer. And then again, as I mentioned earlier, it's very important to get screened early. So the recommendations continue to evolve, which is a good thing because some of them are starting to allow people to get screened at younger ages, which is very good because there are some cancers that are starting to show up in younger populations. And there's a lot of information and research here and there as to why and how those things are happening. But the reality is no one has the one exact answer. Or we would be out of a job, and I know we would be happy to be because we would all love to live in a world without cancer. So I don't unfortunately have a perfect answer for your question to that in terms of where we are in the grand scheme of things, because it is a very lofty goal, but we kind of take it one step at a time. And we don't do that alone. I mean, everything we do, as I said, is really working with people across the state, and also learning from what other states are doing. We often will reach out to other coalitions, finding out what they're doing within their cancer plan, what is working for them in terms of programs and outreach, and see if we might be able to try that on for size. Again, always looking at what data we have in Nevada to know what trends there might be in certain cancers. Are we pretty low in certain cancers in terms of screening? And so then we might want to amp up our efforts in those areas. And so the nice thing is we're always able to kind of ebb and flow with what's happening so that we can try to chip away at that larger goal and get more people the care that they need, because that's really what everybody wants to do.
Sure. My sense is, though, that more states are probably reaching out to you than you are to them because your site and everything is so comprehensive. We're going to take a short break to hear from one of our sponsors, and we'll be right back.
As a proud sponsor of the Gift of Giving, Thomas Dermatology is deeply rooted in its Las Vegas community and is always looking for ways to give back and continue to serve patients of the Las Vegas Valley. Amidst the rapidly and ever-changing landscape of healthcare delivery, both nationally and locally, our singular focus on patient care has remained constant. We have grown responsibly, enabling our team of skincare experts to provide all the benefits of a large practice while maintaining the care and relationships that comes with a small, private, local practice. For patients with cosmetic interests, Thomas Dermatology has an extensive aesthetics department featuring a team of experts who provide cosmetic injections like Botox and dermal fillers, as well as a full suite of state-of-the-art lasers and med spa services. The newest addition to the clinic is a facial plastic surgery division, allowing us to treat the aging face more comprehensively. These services are complemented by our extensive inventory of skincare products, offering patients the necessary and evidence-based ingredients to improve and maintain the health and look of their skin at home. Thomas Dermatology strives to be a part of every step in the patient's journey to healthy skin. We look forward to welcoming you and your families.
Welcome back, everyone, and I'd like to thank our guest, Amy Thompson from the Nevada Cancer Coalition, for being our guest today. And I'd like to thank Thomas Dermatology, our sponsor of today's program. And I'd like to thank them for the care and consideration that they've given me all through the years with my skin cancer. So, Amy, let's talk a little bit about, on your network, there's something called Thrive NV. Would you like to talk a little bit about that and what its purpose is and who is it for?
Absolutely. So we started Thrive NV about 4 years ago, and it is a community-based patient navigation program of Nevada Cancer Coalition. So designing this program came directly out of feedback that we received from a survivor focus group study that we did for survivors and caregivers across the state. In 2017. So we heard from them, feedback areas that they were looking for. And they really voiced needing access to more resources, reliable information. People that did have access to a navigator tended to have a more positive experience. And that really comes just because they had someone that they could reach out to and talk to and kind of figure out what resources they might need and ideally get connected a bit quicker. So taking that information and realizing this was an area of need in Nevada that we wanted to try to fill, we started that program. Like I said, it's going on 4 years now, and it is for adults across Nevada who are dealing with cancer themselves, or perhaps they're a caregiver of someone with cancer, and they may or may not already have access to a navigator or somebody that can help them. And what that means is just some of the hospital systems are equipped with some patient navigators or social workers where they have those folks on staff to help connect people to resources, but not everybody has access to those. So that's what our program is here to try to fill that gap. So for people that might live in rural communities with fewer resources, or even if they're newly diagnosed and not really even sure what they need to do yet, they can reach out to us and we can kind of point them in the right direction. And so through Thrive NV, we've built a sub-website, if you will, off of our Nevada Cancer Coalition site. And that allows people to request patient navigation themselves. They can get access to some community groups, which would be some support groups that might be available in Nevada, and access to learning center, survivor stories, things like that. So we wanted to create a sense of community for people in Nevada that are dealing with cancer, that they have that place to go to not only get some knowledge and access to resources, but also to be able to reach out to us for any navigation, support, connection to community resources, if that's what they're looking for.
What an amazing program. That has to benefit so many people, so many people. As I said, your website's just a gold mine. It's a treasure trove of information out there for not only people with cancer, but family members of people with cancer and how to deal with it. You also have another program called the Oncology Navigation Network that seems to have all kinds of sub-programs in that as well. Would you like to tell us a little bit about that aspect of your coalition?
Yes, so the Oncology Navigation Network was really started a few months after starting Thrive NV, and that was in direct response from some of the local navigation community really feeling a bit siloed, and that we didn't really have a network that we could reach out to each other and share information. And in my previous role, I was one of those people that felt that way. So being able to be a part of the coalition, designing and running Thrive NV, it just made sense to create a navigation network. And so what that is, it's created for navigators by navigators. So essentially anyone who works in Nevada whose job is to help people with cancer and their families get connected to resources in whatever capacity that is. We consider them a navigator for the purpose of our network, and they're welcome to join us. And We started with about 32 members and we're over 100 now. So we're really happy to have that. And it allows us, again, to come together, share resources with each other. Oftentimes we'll invite a community partner or kind of a resource spotlight that would be something that would be applicable for navigators in Nevada to know about, and maybe a direct resource that would help the patients that they serve in their own organizations. And then it offers an opportunity, of course, for networking, talking through circumstances. Perhaps people are having a hard time finding a transportation resource or a financial resource for their patients. And it just provides that opportunity to share instead of being stuck in silos. So we're really proud of that. And we meet every other month virtually, and it is a statewide network. So we're proud of that because we also feel it helps those of us in the roles that we have. It helps us do a better job because the more we know, ideally, the more that we can help connect people to the resources they need. So it's been a blessing for our program, I think.
Yes, sounds like it. Boy, you've just got amazing programs out there. And I see you also have a 5-year cancer plan, and it's got 2021 to 2025. And does this mean that we're now in the middle of it, so nobody can join? Is certain people that are signed into this program or locked into it, or?
No, that's a great question. And the 5-year cancer plan is our driving force as the coalition, and it's never too late for people to join. It is for this particular 5 years. So yes, we are in the middle of it. And as it goes, probably next year, we're going to be starting to write for the next 5-year plan. So that will be a time where we absolutely will be relying and looking for experts across the cancer continuum to join us in writing the next 5-year plan and figuring out those goal areas that, again, that we may have moved the needle a little bit, but perhaps there's more work to be done. And what does that look like for the next 5 years? So the cancer plan, people can think of it as it really provides a framework, not only for us as coalition staff, but really truly for the larger collective, if you will, anybody in Nevada who works in cancer, who is interested in, again, reducing the burden of cancer and kind of aligning with our mission that we talked about earlier. And it guides not only our work within the programs that we do as the coalition, but it's also a way for other people across Nevada, other organizations and stakeholders to look within those goal areas and identify some objectives and perhaps some strategies to work on that they can be working in that same direction within their own organization. So that could be hospitals, it could be public health, it could be community clinics, survivors, caregivers, you name it. It's kind of a all hands on deck kind of an approach. And the goal areas that we have in this particular cancer plan are prevent cancer, increase early detection of cancers, ensure equitable access to healthcare, improve quality of life, and provide high quality data. So those are the 5 areas. And within each area, there are different objectives and strategies.
Oh, that's an amazing program too. You've got so much going on here, and there's some more programs that you have that we're going to talk about after this next commercial break. Please stay with us, everyone. We'll be right back.
At Lucia Capital Group, we've been helping people manage risk and plan for their future through some of the most challenging market conditions. Volatility in the stock market will never go away, so it's really all about your strategy and how you react to it. Our bucket strategy aims to help you manage your financial goals even during the most uncertain times. I'm Joshua Dowden. I've been working with clients here for more than 16 years, and I can help you as well. My office is right here in the heart of Summerlin, just north of Charleston Boulevard. Don't let the stock market determine the quality of your retirement. Call me today for a free consultation. 702-508-6421. That's 702-508-6421.
welcome back to our program. And thank you, Joshua Darden from Lucia Capital Group, for sponsoring this program and for all the financial advice he's given me over the years. Much appreciated. And welcome back, Amy. Thank you for spending time with us today. Also on your website, which as I've said is a treasure trove of information, you've got a lot of educational programs for people to go and educate themselves and learn about different aspects of cancer and so forth. Would you like to just give us an example of some of the educational programs that you've got out there?
Sure, yeah. So on the Nevada Cancer Coalition website, we have a section where we highlight some on-demand videos. Some of them may have been from previously done webinars, either from some of our partners or ones that we've worked with people on. So some of them are in the art of active listening and communication. We did a cancer survivorship series a few years back, and so some of those touch on some of the side effects that people may experience from cancer treatment. So an example of one of those would be radiation toxicity. We also highlight some available training that comes out from our partners. One of those examples is financial navigation training. So when we find things from our partners or things that we've recorded ourselves, as I mentioned, we try to put it on the website. And, we have a great team, and our communications director, Kristen, is amazing at keeping this up to date. And we try to kind of curate this information so that for the providers and public health professionals that we work with and that may be looking for some additional cancer-specific information, we like to have that available to them on our website. We also have workplace resources, and an example of that would be a PTO framework to encourage employers to provide time off for their employees to get the much needed cancer screenings that we all know is so important and oftentimes very difficult to get during regular work hours when we're all juggling so much. And we have some other workplace policies on there as well. So we do have access to navigation, information and resources on the Thrive NV site. And then, as we're mentioning now, kind of the provider and public health focused information on our Nevada Cancer Coalition site. So we try to have something for everyone, and then ideally finding ways for people to connect with us and join us in the work that we're doing.
Yes. Well, I saw quite a few of the programs there. You've got one for breast cancer rehab, and you've got the long-term effects of chemo. You've got a nutrition prevention program, radiation toxicities. There's all kinds of, you've got a financial navigation workshop out there. There really is, anybody who's dealing with cancer, whether it's family or individual, they can find the information out there. Just got to be a little bit resourceful. If people want to volunteer for your organization, I'm sure most organizations are looking for volunteers. Are you looking for volunteers, and what qualifications do they need to be part of the Nevada Cancer Coalition?
Well, this is a perfect question that you're asking, because we happily are designing and starting to launch a brand new volunteer program, hopefully in the first part of the year. So we are excited to see where that takes us, because so far we love volunteers. We haven't had a dedicated staff member to really develop this portion of our work that we know is so incredibly important. So some of the areas that we have used volunteers in the past and that we definitely will use them in the future are in areas of testimony. We work in policy when policy comes up to increase access to care. For instance, we were involved in passing SB 330 that will go into effect January 1st, that reduces out-of-pocket costs for folks needing breast cancer screening, supplemental screening, and diagnostic imaging. And part of that is really crosses the finish line, if you will, when we hear testimony from people whose lives were impacted by perhaps not being able to get access to the screening they needed, or so on and so forth. So that helps our lawmakers really hear from the people themselves. So having volunteers help with testimony when we have policy come up, as I mentioned, sharing their stories, whether that be on the website through Survivor Story or just with other survivors and some of the work that we do. Those are really key and impactful ways that we've been able to use survivor volunteers and caregivers so far. And then we're looking to expand that too, because we're doing a lot of outreach across Nevada, which we love doing. So we attend outreach events, whether those be community health fairs or the like, and we will table at those events and provide education to the community, often about the types of cancer screenings, at what age we should be getting them. And then, of course, having conversations about how to get people connected to resources if they are impacted by cancer. So having volunteers that are interested in coming to events with us to really kind of have the boots on the ground and extend our reach as staff will be really important. And we're looking along those lines for volunteers also in rural communities, so that we truly can get ourselves out there statewide, because we're a staff of 8. We're small but mighty. So volunteers are we're very excited for that, because we really think it's going to be just a whole other helpful workforce as part of us to help us continue to do the work. And we'll probably learn new ideas from volunteers that are passionate and knowledgeable in what their life experiences that they'll bring to this work too. So more to come.
I wasn't aware that you only had 8 staff, and all this
Yes.
information's out there with 8 staff. That's amazing. And actually, I did hear about your organization at a community event in Logandale.
Oh, nice.
Talk about real rural Nevada. That's about as rural as it gets. And
Yes.
you had a booth there, and that's how I learned about your organization.
Oh, that's great.
Now, how do you get funded? Do you get money from the CDC or from corporations?
It is,
Individuals,
it's
all 3?
actually, we get money through the CDC. So it is federal flow-through funds, essentially. So the government, as we kind of talked in the beginning, gives states funding to work on comprehensive cancer control, breast and cervical cancer screening, and tobacco programs, for some examples. And so the state of Nevada subgrants that money to us as Nevada Cancer Coalition to do the work in those areas. So everything we talked about within the cancer plan and all these different programs we have all fall in those categories in some way. And so about 80% of the funding comes from those federal dollars. So we're very lucky in that way.
Cool. Okay, Amy, it's been a pleasure having you on. If people need to reach out to you, do you have a website and a phone number that you can share with us so our viewers can reach out to you, and especially those who are willing to volunteer in the new year?
Yes.
I'm sure you'd love to hear from them. So if you could share that information, I'd appreciate it.
Absolutely. Thank you. So people can go to www.nevadacancercoalition.org. So that's ORG for all things Nevada Cancer Coalition. On that main website, you will also then find the link to click on thrivenv.org, which is our patient navigation and kind of community navigation side of things. Or you can go to www.thrivenv.org directly, but you can just go to the one and then it'll get you to all the places. And then if you want to reach out to us, our number is 775-451-1670. And there is a phone tree, so you can reach any of us that you might be wanting to speak to about the variety of programs that we have available.
Wow. Thank you very much for sharing that information. And thank you, Amy, for being such an informative guest today on our program. You've shared some very, very valuable information. And thank you for everything you're doing for cancer patients and families and research. You're doing an amazing job up there in Reno. So thanks again for being on the program.
Thank you so much for having me.
You're welcome. And I'd also like to thank the producer of our program and owner of the station, John Stiles, for allowing me to host this program. I'd like to thank our sponsors, Thomas Dermatology and Lucia Capital Group, and my business partner for the last 25 years, RJ Champion. You'll hear his message right at the end of this program. And I'd like to thank you, the viewers, for tuning in. If you have any questions or comments, please reach out to me at Stephen@thegiftofgiving.Vegas. I would love to hear from you. And in the meantime, please stay safe, be kind to one another, and have a great week. I hope you will join us next week when our guest will be Desiree Quintana from the Intertribal Council of Nevada. She will be a great guest, I know, and I hope you will join us then. Stay safe. Bye for now.
Mr. RJ Champion is proud to sponsor WWDB-TV's series, The Gift of Giving, and wishes the program much success. Congratulations and gratitude to the featured guests and the organizations they represent. Our community is well served by your tireless efforts to make Nevada a better state for all its residents.